The other advances that I like to talk about in spine surgery are total disc replacement, which we sort of hit on a little bit. And we've actually had more advances in the cervical total disc replacements. And I think the reason we've had more success there is because the cervical spine, or the neck, is a less demanding biomechanical area compared to the lumbar spine. The lumbar spine is obviously bears most of our weight. And so you really got to be, the disc has to be really, I think, much, much better. In the cervical spine, we just have to hold up our head, which isn't too heavy for most people. So the current models are actually quite good. We've had a lot of success with that, and people in the cervical spine are eligible even if they have 2 levels that are bad. The other one that I'm really excited about currently is nanotechnology. And I know that's sort of a sexy phrase that's used in other arenas as well. But the Obama administration actually put a lot of time and effort and funds to develop nanotechnology in different industries in our country because they want to promote that. They felt that was important to be competitive globally. And out of that, in the medical field, one of the success stories has been nanotechnology for the spine. And probably that is maybe a bit confusing for the layperson, even to other doctors actually, because a lot of doctors have not heard about this, but they studied surface fusion technology at a nanoscale, which is the reason why they're allowed to use that term. And it's just a lot of fascinating research. And it turns out that, for decades, spine surgeons, we've been putting in different materials to obtain fusions in our spine. I mean, we've tried cadaver bone, patient's own bone, stainless steel, titanium, polymers, all different kinds. And looking back, I think, in a lot of ways, maybe in a fairly haphazard fashion, Looking at this nanotechnology, they're really starting to figure out what the body likes. And it turns out the material is important too, but also the topography of the fusion surface is very important at a nanoscale, not even a microscale. At a nanoscale, because the cells actually recognize with their receptors the topography of the fusion surface. And that makes a tremendous difference in terms of healing rates, because that sort of drives the reactive or inflammatory response that's responsible for bone healing.